All right, welcome back to Bayou Time. You've heard us talk about the top 100 nurses. Well, we have three of them here in the studio, and we're going to start off with one of them. And I'm going to make sure I get the Russian pronunciation right. Katrina, right? Katrina, but they call you Katrina.
Katrina.
And Katharina is the real name.
They call me Kat at work.
Oh, that's four. That's four variations of the same name, but nonetheless, what a great honor. First of all, congratulations to you, and wow.
Thank you.
That's an earmark on the career, isn't it?
It is. It's been nice to be acknowledged like that.
Yeah.
You know?
And when did you find out that you were one of the top 100 nurses?
Well, I was at work and they kept it from me, which is kind of hard to keep secrets at work.
Yeah.
They called me in and I had no idea. So all my fellow coworkers were surrounding me, and they just kind of told me. I was so shocked and humbled, when they told me.
That's unbelievable. Let me just say a little bit. You work in the Terrebonne General Outpatient Pavilion.
Correct.
And you've been with Terrebonne General for 31 years.
Yes. It's a long time.
How's medicine changed in 31 years?
Oh, wow. Well, when I started, we were doing paper charting. Mm-hmm. So now with the electronic charting, that's a whole nother thing. It's been great, though, because you can kind of see other areas, other hospitals. With the system we use, it's better for patient care,
Right. Why'd you get into nursing? I love to hear these answers because everybody I ask, it's a little bit different.
It is. Well, growing up, I've always been one to care for things, I had a brother who was handicapped. Okay. He had muscular dystrophy, so just over the years caring for him, I learned to be a little bit compassionate. And then I have a sister who's a nurse, and I found out later on that my mom worked in a lab at one of the local hospitals, and I think she secretly wanted to be a nurse. So it was just a natural choice for me to do that.
And it's, I see a lot of nurses that have to be very meticulous. They have to be, like you said, the charting sort of changed the whole world.
Oh, it did.
Of medicine. Mm-hmm. So you had to have a little patience too with that?
Absolutely, Yeah,
is patience one of your virtues?
It is. Yeah, patience and also lifting up other people. I love my job. I think all of us here today, we love what we do. We're very passionate. I wouldn't be doing it for 31 years if I didn't love it.
Right.
And I love watching others succeed. That's part of my coworkers. I got to give a little shout out to them because I work with great people. But I love seeing them succeed, and I love helping them succeed because ultimately, in the end, we're here for our patients.
Yeah, no doubt. And I learned so much about the nurses and the doctors. I thought I'd learned them after 30-something years, but then COVID hit. And then I saw a whole nother side of the dedication and the getting through a pandemic. That sort of changed everybody, didn't it? But y'all really got through it with flying colors.
We did. It was hard,
No doubt.
But we did make it through. Teamwork makes the dream work, We needed a lot of teamwork.
And you're still there.
And we're still there. We really are.
So the war, so to speak, didn't...
Through the hurricane also.
Through Ida, which was unbelievable, the changes in the actual facility structure. So y'all had to deal with COVID, then you have to deal with water.
I think it made us stronger,
Yeah, but you're still smiling.
I am.
So tell me, when y'all got to the Pontchartrain Center, what was that like?
Oh, it was great seeing there was 100 of us, so it was great just meeting, other nurses like yourself and just hearing their stories. And, we were just so happy.
Right.
We were all there with the same nomination, that somebody likes us, We must be doing something right.
You get to see your peers, though.
Yeah.
And I know everybody's eyeing everybody up to see who's in that top 100.
Yeah.
But did y'all know a lot of the other nurses?
I not really, but I did meet, a lot of good nurses, but we had a good time.
Yeah.
It was real fun.
And so I guess you have to have a certain amount of drive to be a good nurse too, right?
You have to be selfless. You have to just take the time and, just relax, stay calm, And I just like mentoring others. You know, I just like seeing other nurses grow along with the things that
so
I've
you'd have
learned.
made a great teacher too.
I
But
do.
really, you are teaching, right?
Always.
Yeah. Nursing is teaching.
Always teaching. Always learning, too.
I always say that I don't want to disrespect the doctors, but the nurses have to tune in real quick and pick up things real quick. And we all need our doctors, but those nurses are so important.
Yeah,
and
we
I guess
really-
that's why this was established, right?
Absolutely. You know,
How many years you going to practice? Do you ever get tired of it?
no. I probably have about 12, 13 more years to go. So,
Well, keep going. And I love we were talking before the show. How you say it again in the Russian, Katrina?
Katrina.
Katrina. All right. That has a good ring to it. Well, congratulations on a great job well done. 100 top nurses, and you're one of them. And we hope to see you. Let's make it another 20 years. All right. Fair enough?
Fair enough.
And thank you for coming, and good luck in your future.
All right. Thank you for having me.
Congratulations. What a great honor.
Thank you. It really is.
And I'm looking, sort of kidding before you came on, but MSN, MBA-HC, CGRN, CER. So let's educate the public and me.
Okay.
What is MSN?
Master's in nursing.
Okay. Got to be pretty smart to get a master's. I don't
I
have
don't
one.
like to brag.
Well, I'm bragging for you, top 100. All right, MBA-HC.
Master's in business healthcare.
Okay. CGRN.
Certified gastroenterology registered nurse.
Okay. And a CER.
Certified endoscope reprocessor.
Okay, there you go. Now, so you're the nurse director of ambulatory services and PACU, and you've been with Terrebonne General for 32 years.
32, going on 33.
Wow. Now, what is the PACU?
Post anesthesia recovery unit
Okay.
or care unit.
What got you? Everybody's different. What got you in nursing?
When I graduated high school, I really was unsure what I wanted to do, and my mom had worked at Terrebonne General. She actually retired after 30 years of being here, and she had encouraged nursing, and I had never even, it wasn't even on the radar. And I started looking into it, and there's so many aspects of nursing in which to go. School nurse, hospital, clinic. It is never ending with possibilities. You could go into teaching. So it was really a career with, vast opportunities. So
And I found over the years that on a patient side, when you're in there, the nurse plays such a critical role in getting you over the hump.
yes,
They know the guidelines. They know what to do. They know what to say. They know what kind of encouragement to give you. They know when to push. They know when to lay back. What teaches you all that? Is it just experience?
that and just treating people how you would want your mom treated. That is really what I hold in my heart and in my mind when I'm taking care of a patient, talking with them. How would I want my mom treated?
And I got to go back and I'm going to ask each of you, all three of y'all, the same thing, because I know I keep going back to COVID and Hurricane Ida. But my God, sitting on this news desk and interviewing people by Skype, or some who came through the back door, like Phyllis and Dr. Adams and a few others, just seeing the pressure that you all were under. That was make or break time. But y'all are still here and still smiling.
We are, and we always will be.
Yeah.
The leadership at Terrebonne General really so strong, brought us through it. Phyllis, just a rock. Was a rock for us. Teresita, I can't say enough about administration. They just guided us through the whole thing.
And when you look at medicine and how it's evolved over the years, as a nurse, do you get excited when you see some kind of breakthrough
Oh,
in
absolutely.
technology? Do
It's-
y'all get behind closed doors and just,
I do. Maybe some people go, oh, something else to learn. But just watching how nursing and healthcare in general has progressed through the 30 years. I mean, back when I started, people were being admitted the night before for surgery the next morning. So we go that far back, and, maybe a gallbladder stayed in 5 days. It's crazy. Now they go home the same day. And it's just wonderful seeing the advancements. And the sooner you can get people back home, the better they heal, I find.
Yeah, and same question, when you had to switch the system over, and I know some of the older doctors had to go from paper to computers, and I talked with a few of the older doctors, and they were going like, not on my wife. But sometimes you got to take a step back to move forward, right?
Absolutely. I mean, from a quality perspective, it's really the best thing for the patients, for the hospital, for everyone. I did have a few nurses retire at that time that we flipped over to electronic charting, but it really is the future.
Right. So what was it like when you found out you were one of the top 100?
Surreal, a little bit. I was in my office and I got an email, and I thought it was a joke. I thought it was spam. I thought it was one of those things that IT said, hey, we're going to be checking out to see if you click on something that you shouldn't be. And I was afraid to read it. And then I went over to Deborah Lewis, who had nominated me, and I said, did you nominate me? And sure enough, it was true. And it just feels like the pinnacle of my career. I'm honored to be in the same class as, the other recipients, even Katrina and Donna. I'm amazed that someone sees that I'm on that level, and it still bewilders me.
And I guess with about a minute left, it's sort of based on consistency of your job, and it show up every day and you do this but it's a consistent level of excellence.
Yes, it is. It goes into mentoring, how have you contributed to mentoring others? It's just been, just an incredible award.
Wow. And congratulations are in order. And once again, I'll ask the same question as we close. At the Pontchartrain Center, pretty good event?
It was wonderful. It was great being on that side of the event, because I've nominated a few people and I've gone to the event, and just to be on the opposite side, it was just totally surreal. That's the only word I can think of.
Well, congratulations, Susan. Job well done.
Thank you.
Keep up the great work.
We will.
The third of 3 top 100 nurses at Terrebonne General Health Systems. And we want to welcome Donna Ward to the program.
Thank
Good
you.
to see you again. How are you?
Good, wonderful.
And I want to thank you because you took care of Dad in the
That was
CCU
my
in
honor.
2018. So thank you for that. We
You're
appreciate
welcome.
it as a family. All right, so let me ask the same question. MSN, we talked about that. RN, we know. CCRN, what does that mean?
That's Critical Care Registered Nurse. It's a national registry, a certification that we can get.
Okay. So you've been at Terrebonne General for 11 years and currently the Clinical Employee Training Manager in Professional Development.
Yes,
How tough a job is that?
tough. My department's responsible for all the education and training for the organization.
Okay.
So very tough.
So not only a nurse, but here we are teaching again.
Yes,
Teaching and nursing go hand in hand, right?
they do. Everything that we do as a nurse, you're educating your family members, your patients, yourself constantly, because as you mentioned earlier, as fast as medicine changes, we have to keep up with all of that. So now on the education side, it's my responsibility to make sure I'm keeping up with all of these changes as they come in, educating myself so that I can educate the staff.
And I didn't ask the other two, but I'll ask you. As a kid, when you were growing, of course, when we growing up, we want to be football players or baseball players. Occasionally, you want to be a doctor or a lawyer or whatever. When you were growing up, did you ever consciously say, I want to be a nurse?
Honestly, I wanted to be a jockey, and my mom told me I was going to be too tall. I wouldn't be able to ride the horses.
Your mom turned out to be right. You are
She was,
tall.
she
You're very
was.
tall. When did you decide you were thinking about nursing?
Honestly, I was on a different path. Nursing is my second profession. I was a paralegal for many years. And then after Katrina, I had the opportunity to go to nursing school. And it was funny because several years before Katrina, I was actually trying to go to nursing school at night, because I had worked on some different cases where I thought that would help in what I was doing. And so when I had the opportunity, we were in another state, another city, and I needed to do something. And just so happened the county hospital was right there close to where we ended up, and next door was a school, and a whole lot of prayer, and God opened the doors for me, and it was the absolute best decision I've ever made. Many times I've said I wish I'd have done this a long time ago, but then I realized he was preparing me for this, and there were other things I needed first.
So unlike a lot of people, you were sort of listening to your heartstrings.
Yes, very much
And
so.
Being in the legal profession and the medical profession, that's two different arenas altogether.
It is, but especially in what I do now with education, making sure that we are doing everything appropriately, making sure that we are training our staff appropriately, that they know how to do things, and crossing those T's and dotting the I's, so to speak. That's always been very big with me, even at the bedside with, documentation and following orders and knowing procedures and patient care and making sure that you're doing everything you're supposed to.
So can I add after your name, meticulous?
Yes, probably so, yes.
And it's especially in the medical field, everything is so regimented, and with the new laws, the laws have changed a lot over the years, haven't
Yes, yes, they have. And it all has to do with patient safety. It's, one mistake can cost a life. And I think that was my fear coming out of nursing school. I was so afraid I was going to harm somebody because I realized since I was older, I realized how much power, in a sense, we have as nurses because we're right there at the bedside. And if I am not taking every step along the way to make sure I'm doing it right, it could harm somebody. So that's why we have those safety checks in place. That's why we make sure that our staff know exactly how to do things so that it doesn't hurt anybody.
Same question I asked the others. The Pontchartrain Center, they'll walk in. I'm sure it was pretty fancy, pretty nice. How did it make you feel?
Honored. A part of me thought, I don't deserve to be here. Why am I here? Why was I chosen for this? Very humbled with a lot of the nurses that were there. You met Katarina and Susan and how long they've been nursing, and I still feel like a newbie compared to them. So I was very, very honored to be there.
Yeah, but you had a whole career before this, so
Yes.
maybe they took that into consideration, And
Maybe
I'm
so.
sure you brought that experience with you into nursing, like you said.
I hope so. I try to. Being a paralegal is a lot of research. And so that's one thing that I love to do is research new procedures, research old procedures. What have we learned from the past? Where are we moving forward? Where are we going to be in 5 years from now? Because we see how fast everything changes. So.
Right. And you're right. In your profession, making a mistake is critical. It's maybe a little bit unfair, but you almost always have to be in your A game, right?
Yes, most definitely. You do.
So every day when you're going to work, how many cups of coffee before you get to your A game?
I only have 2. That's it.
Only 2, huh?
Yes, I limit myself to 2.
Are they one of those big cups or small cups?
No, it's, my little Keurig, and I put it in a big cup, but
Yeah.
not too much. I try to stay away from the caffeine.
Well,
It's hard to start an IV with shaky hands, so.
well, that's true, but I'm sure you do just fine. Thank you. Congratulations and job
Thank
well
you.
done. And keep up the great work.
Thank you. Thank you for having me.
Anytime. All right, there you have it. The top 100. 3 nurses from Terrebonne General Health Systems. We'll take a break. We have some great medical professionals here in the area. We'll be right back. Don't go away.